Hi, my name is Twinkle Mehta, and I go to Emory University School of Medicine in Atlanta. I'm from Nashville, Tennessee originally, and I went to undergrad here at Emory. So the reason that I decided to go into medicine is really a combination of many different reasons. I've always been pretty fascinated with the human body and kind of just like picking up little bits of information of like the biological puzzle and like putting them together to try to figure out like a differential diagnosis. It's always been very exciting to me. And I think in college while shadowing, the times that I was shadowing have been some of like the happiest times of my life. I really like getting to know people's backgrounds, their histories, kind of like their narratives, and just getting to know them as a person. I enjoy meeting new people. Like if I see someone walking down the street and I'm like, oh, I wonder what their life has been like. I wonder, like, do they have kids? Maybe I'm a little nosy, but so really I guess it's like a combination of those two things kind of pointed me in the direction of medicine. And then once I started shadowing, that really solidified my desire to go into it. So I was a biology major and global health minor. So the reason that I went into biology is really because of one professor. I had a really amazing professor my sophomore year of college. I was initially a psych major when I came to college, and when I had this professor, the way that he structured the class was completely centered around case studies, and then he didn't teach at all during lecture. We would just, break into groups and do these case studies, and then we would do the actual learning from the textbook outside of class. So it was structured like a completely different way than any other science or non-science class I'd ever taken. And so I think taking that class kind of opened my eyes into how exciting biology could actually be. It's not just like memorizing facts, and it's definitely not black and white. There are plenty of shades of gray. So he's the one that really got me interested in it, and then it just kind of went from there. I got more and more interested in it. So I was involved in a few organizations in college, and I'll just kind of talk about a few that I was really invested in. I was really involved in something called ICE, which stands for Indian Cultural Exchange. It was basically just a cultural group on campus, and we hosted a lot of cultural events to kind of give the Emory community a taste of what Indian culture was. So I did that throughout college, and I was also involved in global medical brigades, and during the summer basically what we did is we hosted a 1 or 2 week medical brigade in a country like Honduras or Ghana. So every summer we would go to these countries and set up basic medical clinics in generally a more rural area to provide the people there with basic medical care. So I really enjoyed doing that as well. I was an orientation leader, which is basically just you're there to welcome freshmen onto campus and kind of show them the ropes and be their guide and mentor as they adjust to Emory. So that was a really meaningful experience for me as well. In addition to that, I did some research on campus at Emory for a few years. So I think those were the biggest things that kind of like made my college experience. So I also took a year off in between undergrad and medical school, and I did an AmeriCorps program called Impact Alabama. It was based in Birmingham, Alabama, and basically what we did was, it's actually kind of complicated to explain, but we had 4 different initiatives throughout the year. So I did everything from coach a middle school debate team to doing tax return for low-income families in Auburn. So I didn't really do anything medically related in that year off, but I did get to travel all throughout Alabama and see kind of the entire state and what it was like and I got to help a lot of families in the state of Alabama. It was definitely an experience that I would recommend to people if they are looking to take a year off, but I will say that it's pretty difficult to live on the stipend that they give you, but I think it is a very enriching experience. So the biggest piece of advice I would give for someone that's wanting to go into medicine is shadow. You can love science and love everything about it and still, you know, not be cut out for medicine, because medicine is so much more than that, and you don't really know, you know, definitely if you want to go into this profession unless you're actually in the hospital or in the clinic and actually, you know, interacting with patients, physicians, the whole medical team, and seeing if that's a setting that you want to be in for the rest of your life. So that is my biggest piece of advice. Other things, just be involved in college in things that you're actually interested in, because it will show on your application. Don't, you know, I mean, obviously, like, it's easier said than done to not spread yourself too thin, but I would say find maybe like 2 or 3 things that you're really passionate about and just invest a lot of time in them. I know that there is a medical school checklist, like you have to do research, you have to volunteer, this, that, and you know, those things are important, but I think what's more important is really finding what you're passionate about and just putting your energy into those things. Other things I would say, get to know your professors. They can be a really, really helpful resource for you, not only with recommendations, but just with life, because they've been through life, and a lot of them are willing to help you or willing to mentor you. And I definitely know that I wouldn't be where I am today without the help of my professors. So even if there's like one professor that, you know, really impacted your, you know, your way of thinking, then really get to know them and make an effort to like stay in touch with them. Just know that you don't have to be a biology, chemistry, you know, science major to get into medical school. Medical schools like students that are very well-rounded, so if French is your thing, then major in French. And it might be a little bit more difficult to complete the prereqs, but you will probably be much happier. And you know, it makes you stand out a little bit on medical school applications as well. Also, I mean, you kind of have to love science in order to go into medical school, so make sure that you actually like what you're studying. I mean, I know sometimes it can be a little tedious, especially if you're, you know, studying organic chemistry and you're just like, you know, is this really what I want to be doing the rest of my life? But I think just having an appreciation for science itself, but also a realization that, you know, science is not 100% and things can change, and things do change every single day. So advice for the MCAT. So I'll kind of just talk about what I did in order to prepare for the MCAT and kind of maybe what I could have done better or what I would have done differently looking back. So what I did is I basically just took a class over the summer and also did research at the same time at home. And this class, it was a Kaplan class. It met like twice a week, and then I did research 3 or 4 days a week. So I basically gave myself about 2 months to prepare, and I put in a lot of time. I went to all my classes, my MCAT classes, and I did all the homework, and I think the thing that helped me most was just taking lots and lots and lots of practice tests, because yes, the MCAT is a test of your knowledge of, you know, basic sciences, but it is also a test of how well you can take the test. And I think it's very important to keep that in mind. So I've heard from a lot of people that and what they used to self-study was exam crackers. I personally didn't use it, but I've looked through the books and I kind of wish that I had, because it really condenses the information into very digestible tidbits. So I don't think it's something that you necessarily want to use on its own, but I think it's a great supplement to what you might use, you know, like Kaplan books, for example. But I don't think you need to take a class. I think it's helpful to kind of structure your studying. And I think, like I said, the biggest thing is just taking lots and lots and lots of practice tests. They have them online for free, and if you take a class, they also give you, I know that Kaplan and Princeton Review also give you, you know, X number of practice tests to take as well. So I think that's really the thing that was most helpful to me, and that's where I saw my score jump the most, is as I was taking those practice tests. But obviously you need to do a lot of studying before you can get to that point. So one caveat to everything that I'm saying right now is that in 2015, the MCAT is going to be very different from when I took it in 2010 or something, somewhere around there. There's going to be, I mean, a lot more social sciences on it, a lot more humanities related subjects. I think it's going to be longer, maybe, don't quote me on that. I don't really know too much about this new MCAT, so I think that the people going forward in 2015 will probably be able to speak to that test a little bit better than I can. But I think just in general, I think classes are useful in order to keep a structured study, you know, habit, in order to force yourself to do a certain amount within a certain amount of time, but I don't think that they're essential.